Today, we're right smack in the middle of a really intense federal fight around our nation's budget, and unless Congress acts in less than 2 weeks, we're going to see $85 billion in cuts to vital services like Meals on Wheels, Head Start, disaster relief, and startup loans to small businesses as part of the automatic sequester pushed through the Tea Party Congress in 2011. But it doesn't end there. After that, Congress is going to have to reauthorize funding for government operations at the end of March, and already people like our own Senator Pat Toomey are threatening a government shutdown in order to extract huge cuts and painful changes to Medicare, Medicaid, and Social Security. Ideological opponents of these programs that protect seniors and working families want to have a debate that's only focused on cuts. One that looks to our parents and grandparents to pay more so that corporations and the wealthiest Americans can continue paying less. What they want to distract us from are the lobbyists behind the curtain, the ones who are driving this process and putting our families and our future at risk. And we all know that our government, just like this rope, should be on the straight and narrow for everyone. Right. But we have a situation right now where last year in 2012, there were 12,374 registered lobbyists working in D.C. That's more than 23 lobbyists. That's more than 23. That's more than 23 lobbyists for each member of Congress. And while we're working hard here in Pittsburgh to raise our families and contribute to our communities, there are 12,000 Larrys. There are 12,000 of Larry running around D.C. working for big banks, big drug companies, oil companies, and insurance giants, and they are working to create loopholes that transfer our hard-earned dollars into the pockets of their corporate clients. Look, they're making a loophole right now. So while we're working hard and trying to get by, lobbyists like Larry here, lobbyists like Larry are out in D.C. in force, working to get more of our money into the pockets of their corporate allies. I want to show you a little bit about how that works.
Well, young lady, what are you up to today?
I want to go enroll my son in preschool. I want him to have a great start to his education.
You want to enroll your son in preschool, make sure he gets a great start with his education.
Yeah.
That sounds nice. That sounds like a really good idea, but I have a kind of a pop quiz for you today. How many members of Congress do you have in your purse? Are you carrying with you personally right now?
Nothing.
No members of Congress?
No.
Well, I can tell you Larry, I'm looking in there right now, he's got many, many members of Congress in his pocket. And I'm afraid your money is not going to go for preschool. Thank you very much. It's going to have to go into the lobbyist loophole. Sorry about that. No, if you'll just. You see what? Like you're on your way to a bright future. What are you doing, miss?
Well, I'm going to college. I want to be a teacher.
You want to be a teacher? So
Yeah.
you have a dream to be a teacher. That sounds wonderful. That sounds great. But I have to tell you something. Larry the lobbyist has a dream too. He has a very beautiful dream of a bigger yacht, right? So his dream is going to have to take precedent over your dream of education. I'm going to have to take this education from you. Yeah. It's going to have to go into the lobbyist loophole for Larry. Right, it's a beautiful dream, Larry.
Yeah. Thanks to the yacht.
Well, ma'am, how are you today?
I'm fine. I'm on my way to the drugstore to get my prescription filled.
You getting your prescriptions filled today?
I am, because I have to stay healthy and active for my retirement.
So you're retired and you want to stay healthy and active. Health is a priority for all of us and for our retirees too. But Larry the lobbyist has other priorities. His priorities are for profits for his clients. I mean, I'm afraid that's how you heard about the big pharma loophole?
I haven't.
You haven't heard of that? Well, you're going to hear about it right now because your drug money is going to have to go into that big pharma loophole, and that's just the priorities. Those are Larry's priorities. I'm sorry about that.
Wait a minute now, Larry. Our representatives are supposed to work for the people, for our priorities, not for the big money special interests like you. You might have all the money, but there's more of all of us than there are of you. And we're not going to stand for you taking our money anymore, Larry.
Tide's turning, Larry.
Oh, the tide's turning.
Tide's turning. We're going to close this loophole. We're going to have to shut this down. All right, we're going to have to shut this down. When I say close the loophole, you say lasso Larry. Close the loophole.
Lasso Larry.
Close the loophole.
Lasso Larry.
and stop lobbyists like Larry. This was a fun skit to illustrate a very serious point, and we can get this done. We can win a federal budget that reflects our priorities, and with the help of all of you and champions like Congressman Mike Doyle, we can do it. So I want to bring out the Congressman's District Director, Paul D'Alessandro. He's going to talk to us a little bit about where Mike Doyle's at on this right now.
All right.
Thanks. Thank you, everyone. Congressman Doyle's out of town, so he can't be here today with you. He asked me to represent him and read this statement outlining his views on sequestration. Congressman Doyle has consistently supported responsible deficit reduction. However, he believes that it's irresponsible and counterproductive to slash essential government programs when so many Americans are unemployed and the economy is sluggish. We're here today to highlight the sequestration cuts that are scheduled to take place in less than 2 weeks. A number of Republicans in Congress have expressed their support for letting these devastating cuts take effect. Abstract spending cuts might not sound so bad, but if you dig down to the details, the cuts are pretty devastating. For example, there'd be fewer employees to operate the FAA's air traffic control system, which is likely to reduce the number of flights allowed per day. Fewer FBI agents and U.S. Marshals to protect the public and track down criminals. Fewer special education teachers and aides, which will hurt over 500,000 special needs students. Fewer teachers and aides in low-income neighborhoods, which would reduce the quality of the education received by more than 1 million school children in some of our country's most economically disadvantaged neighborhoods. 100,000 fewer children allowed to enroll in Head Start. 100,000 fewer people served by homeless assistance grants, putting many of them back out on the streets. 300,000 fewer disabled, low-income, and elderly people getting federal housing assistance. 400,000 fewer mentally ill adults and emotionally disturbed children treated. 900,000 fewer participants in the WIC nutrition program. 1 million fewer patients would be served by community health centers. Congressman Doyle strongly opposes cuts like the ones I've just outlined. He believes they're inhumane and counterproductive. He believes that allowing sequestration to kick in is an extremely irresponsible economic policy as well. Nonpartisan economists have estimated that sequestration would destroy nearly 1 million American jobs and reduce economic growth in 2013 by a third. Congressman Doyle believes there's a better way to achieve the same amount of deficit reduction without hurting the poor and the middle class or the economy. He wants you all to know that he opposes sequestration and supports preventing the sequester by closing tax loopholes for the rich and getting rid of wasteful corporate welfare. It's pretty easy to find $85 billion in wasteful tax loopholes and corporate welfare. Less than 2 weeks ago, in fact, Congressman Doyle voted in support of passing legislation to reduce the 2013 federal deficit by that amount, by cutting agriculture subsidies, eliminating tax breaks for oil and gas companies, and enacting the bucket provision to ensure that taxpayers with incomes of more than $2 million a year pay a higher effective tax rate. In the end, we're talking about a choice. We can reduce the deficit through policies that place most of the burden on the poor and the middle class, or we can ask corporations and the wealthy to bear their fair share. Congressman Doyle supports asking those who are the most well-off to do a little more. And judging by your presence here today, you do too. Congressman Doyle asked me to let you know that he will be working hard in the coming weeks to oppose irresponsible deficit reduction plans like allowing sequestration to take effect, and that he will be fighting to maintain the Medicare guarantee, protect Social Security and federal safety net programs, and make much-needed investments in education, science, research, and the infrastructure necessary to compete in the economy of the future. So thank you very much for having me.